I just want to go over some of the features of the skull here. So some of the more basic bones is the occipital, parietal, frontal, and temporal bones, which compose the skull. You've also got the mandible towards the bottom in blue, the maxilla just superior to that in green. The lacrimal bone is going to be more medial inside the eye socket, and then more lateral inside of the eye socket is the sphenoid shown in pink. And then the opening to the ear canal is the external acoustic meatus. You've also got the nasal bone in green here. And then the zygomatic bone, which is in white, you can see there's the zygomatic arch, which is more lateral of the eye socket. It's this ridge or process right along here. So here again, you can see the frontal bone. We've also got the better view of the nasal bone right here, the parietal in blue back there. And then on the mandible, you have two small holes, which are the mental foramen. You can see the maxilla again in green. And then the vomer here is this bone in the center of the nasal cavity. It's a spear-like bone. Here we have a better view of the ethmoid bone, which you can see in tan, more medial inside of the eye socket. And then the sphenoid bone you can see in pink, more lateral inside of the eye socket. And then in the back you're going to see a little hole, which is the optic canal. And I'll go into a little bit more detail for the foramens. So here, this photo is showing the nasal conch. So at the top, you're gonna have the superior nasal conch. So let me get a better view of that. That is the dark blue bone in the center. And then the middle nasal conch is in red right here. This is showing inside the oral cavity. You've got the palatine bone, which is going to be this green bone at the back of the mouth. And here you've got the hard palate. And then this is just showing on the occipital bone, there's this ridge, which is the external occipital protuberance. So this is just showing the superior orbital fissure. So the optic canal, which I talked about earlier, is this little dot. It's a very circular, right at the back of the eye socket. And then just lateral to that, there's this oddly shaped foramen, which is the superior orbital fissure. So let me show a little bit more depth, a little bit more detail on that. Here you can see it. So this is showing the sutures on the skull. So at the front of the skull, separating the frontal bone from the parietal bone is the coronal suture. So that's running right along here at the front of the skull. Now in the middle of the skull, separating the two parietal bones is the sagittal suture. And then at the back of the skull, separating the occipital from the parietal bone is the lambdoidal suture. And then separating the parietal from the temporal bone is the squamous suture, running just along there. So now I'm going to show some of the foramens. Okay, so we're just going to go down the list here. The foramen ovale is this little dot here. The carotid canal is right here and is just anterior to the jugular foramen. So those two are going to be close together, the carotid canal and the jugular foramen. And then we talked about the external acoustic meatus on the side of the skull, which is the opening for the ear canal. And then the stylomastoid foramen is a very small hole, and it's going to be just in between the mastoid process and the styloid process. So here you can see you can find the mastoid process quite easily. And then this protuberance here is the styloid process. So just in between the two is the stylomastoid foramen. And then you have the foramen magnum, which is the large opening of the skull, which the spinal cord passes through. So just around that, you have the occipital condyle on either side here. Here's the external occipital crest on the occipital bone. And then this is just showing the styloid process I talked about earlier. And then here is the inside of the skull. If you took a section of it and looked down inside of it, you've got the cribriform plate at the front of the skull here. The foramen rotundum is right here. These four little holes here. And then the internal acoustic meatus is where the external acoustic meatus meets, and that's the ear canal.